Management of pelvic inflammatory disease. General Mayor. Rest. A pregnancy test should be performed. Appropriate analgesia is advised. Parental therapy as an inpatient is advised for those having the severe disease. Patient should avoid the sexual intercourse. Medical management. Outpatient regime. The regime 1, we give the ofloxacin 400 mg BD plus metronidazole 400 mg BD. In regime 2, we give the moxifloxacin BD daily. In regime 3, ceftriaxone 500 mg intramuscularly. Immediately give the doxycycline 100 mg BD plus metronidazole 400 mg BD. Inpatient management. Regime 1, ceftriaxone 2 gram IV daily plus orally we give the doxycycline 100 mg BD followed by the oral doxycycline 100 mg BD plus metronidazole 400 mg BD. In regime 2, we give the clindamycin and gentamicin. Loading dose of the gentamicin is 2 mg per kg. Then we give the oral doxycycline VD plus metronidazole 400 mg BD. Regime 3, ofloxacin 400 mg intravenous BD plus metronidazole 400 mg BD. IVTD is followed by the oral ofloxacin 400 mg BD plus oral metronidazole 400 mg BD. Case number 1, woman complained with the chronic pelvic pain and dysuria, no fever, vomiting and diarrhea. On physical examination, uterus was normal in size but it was tender, tenderness and vaginal furnaces, no adnexal mass. How we will manage this patient? We start the treatment on OPD basis. As outpatient management, we give the ceftriaxone 500 mg intramuscularly. After that, doxycycline 100 mg BD plus metronidazole 400 mg BD. We must give the treatment to her partner. Case 2, woman comes with the severe pelvic pain and the dysuria with the fever, diarrhea and the severe vomiting. On physical examination, lower abdominal tenderness and the guarding was present. Uterus normal in size but it was tender, tenderness in the vaginal furnaces and there is the adnexal mass on the right side. We admit the patient, give the ceftriaxone 2 gram IV daily plus doxycycline 100 mg BD plus metronidazole 400 mg BD for 24 to 48 hours. What are the indications for the hospitalization? If the patient have the suspected ovarian abscesses, severe illness, vomiting, temperature, uncertain diagnosis, unresponse to the outpatient therapy for 48 hours, intolerance to the oral antibiotic, coexisting pregnancy, patient is known to have the HIV infection or immunocompromised. Protective factor, barrier methods, especially condom, diaphragm with the spermicide. OCPs have got two preventive aspect: produce a thick mucus plug, preventing the ascent of the sperms and the bacterial penetration, decrease in duration of the menstruation and create a short interval of the bacterial colonization of the upper tract. Monogamy are having the partner who have the vasectomy. Other protective factor are pregnancy and menopause. Prevention, educating the patient to avoid the reinfection and the potential hazard of it. The patient should be warned against the multiple sexual partner to use the condom.